Hello everyone, I'm Dr. Ahmed Sharif and I'm back with a new series that came up to my mind out of the blue, which is called History Taking Simulation Challenge Part 1. And the idea of this series that I'm going to ask ChatGPT to simulate a real life case, and I'll try my best as a 5th year medical student to ask leading questions so I can reach to the diagnosis, and maybe I would love to ask for some investigation so I can confirm the diagnosis. So let's begin. Alright, as we can see here, I asked ChatGPT to simulate a real life case, to have a name, occupation, residence, and as we all know, to start approaching a patient, you have to firstly introduce yourself. So I'll type, hi, I'm Dr. Ahmed Sharif. How are you? Okay, so what's your name? Let's start with the personal history. Name is John Michael Adams. Okay. How old are you? '58. So we're talking about an 58-year-old male patient. So is almost an elderly male patient. Okay. Let's ask about the occupation. His truck driver has been working for over 30 years. That's important to know. All right. Okay. Let's ask about residence. Small town, alright, Springfield. Alright, you were born in the same town. It's important to know about the location of birth and is he living in the same area or not. No, he was born in Detroit and he moved to Springfield 20 years ago. Alright, let's ask about the marital status. He's married for 35 years. You have children. He has 2 children, 32, and a daughter, 28. Alright, that's cool. Let's ask if this patient is smoking. Are you smoking? Yes, so he has been smoking for 35 years. Smoked around 1.5 packs of cigarettes a day. Alright, what about alcohol? He do drink alcohol, but only socially. Maybe a couple of beers on weekends. Alright, so he's lightly alcoholic. He's not heavily alcoholic. He just drinks in the weekends. Okay, what about illicit drugs? No illicit drugs. So apparently we're facing a 58-year-old male. He's an elderly male patient, living in the Springfield, working as the truck driver. He's married for I guess 35 years and has 2 offspring, and the youngest is 28. Yes, and he's smoking, has been smoking for 35 years, half packs of cigarettes per day, and he's alcoholic just on the weekends. He's just socially alcoholic. And no illicit drug use. Alright, so let's ask about the complaint. Why did he come today to the hospital? Why did he seek the medical advice? What is the problem? Well, doctor, for the past few weeks, I've been having this chest pain that comes on whenever I walk or do any physical effort. It feels like a tightness or pressure in the middle of the chest, and it does go and goes away when I rest. That's why I decided to come see you. For how long? For 3 weeks. So apparently from the complaint of patient, which is not a real complaint, just an AI that gives all the details about the complaint, it seems to be like an ischemic chest pain. So we have to ask more about the characters of this chest pain, which is for 3 weeks. But before I dig in the analysis of the complaint, I would love to know more about the past history of this patient. Does he have any of hypertension, diabetes, any chronic illnesses that would be a risk factor for this problem, which is mostly an ischemic heart disease? Do you have any chronic illnesses like hypertension or diabetes or hyperlipidemia? Yes, so he has been diagnosed with high blood pressure about 10 years ago and also have high cholesterol, but he's not diabetic. That's great. So let's ask about any thromboembolic events. Have you had any embolic events before? No, no DVT, no pulmonary embolism. That's great. All right, so let's analyze the pain. All right, but before we ask about the pain, let's ask about surgical history. Have you had any surgeries before? It's important to ask about the surgical history. Yes, he had history of a gallbladder surgery. All right, he had cholecystectomy for gallstones. No surgeries. All right. Let's ask about the chest pain. So the chest pain start acutely? It's important to ask about the onset of chest pain. It didn't start suddenly, it's gradual. So it's gradual onset. Past weeks, at first it was mild and only happened when I walked long distances, but now it's happening with even light activities like climbing a few stairs. So this is progressive. It's a gradual onset, progressive course chest pain, which as he mentioned before, it's in the middle of the chest. All right, so I don't have to waste a lot of questions. He says that the character of the chest pain is tightness or pressure, and it goes when rest. So when rest. All right. So I would love to ask about: does this pain radiates to another places? Apparently, a lot of you could have reached the diagnosis now, but just we have to confirm the diagnosis. All right. Pain sometimes radiates to the left shoulder and down to the left arm. It gets intense. Occasionally, I also feel a bit of discomfort in the neck and jaw during these episodes. So, how long does the episode stays for? Typically, the ischemic chest pain stands for 5 to 10 minutes, and they just fades away once the patient rests or takes nitrates. Do you take any medication during episode? Maybe he's taking a vasodilator like nitrate, sublingual one. No, he's not taking any medication. All right. Are there any associated factors like shortness of breath, palpitations, or even syncope? Yes, during the chest pain episodes, sometimes he feels shortness of breath, especially if keep walking through the pain. Also notice palpitations like my heart is racing, but I've never fainted, no syncope. Alright, this is a problem. Having a palpitation indicating one of two things. Either hypervolemia, which is present in anemia and aortic regurg and a lot of problems, or even arrhythmia. So I would love to ask about low cardiac output symptoms. Maybe this chest pain is related to low cardiac output symptom, or due to aortic stenosis or any other problem. Do you experience any easy fatigability or oliguria or myalgia? I know that I'm using the jargons, which are the medical terminologies, but I'm just trying to sum up the idea, This is ChatGPT. But apparently in real life, you're not asking the patient medical words or medical terminologies. So he is not having easy fatigability. Oh, yes, he have been feeling easily fatigued, even on small tasks. No oliguria. And he have no low cardiac output symptoms. Let's ask about orthopnea. What about orthopnea and paroxysmal nocturnal dyspnea? Just to exclude all these problems and to sum up the idea, which is an ischemic heart disease. I just don't want to take long period to diagnose this patient. It's an apparent easy case. We can diagnose the patient is smoker, having hypertension, dyslipidemic. So this patient is having my provisional diagnosis, just to end the video, my provisional diagnosis is ischemic heart disease due to presence of risk factors including smoking, hypertension, and hyperlipidemia. This patient should be an obese patient. He's hyperlipidemic. At the same time, he had gallstones and made cholecystectomy, which is one of the leading factors as being obese. Yes, let's see. Here we go. We got the real diagnosis, which is stable angina. Yes, I mean the stable angina, which is ischemic heart disease. Alright, so your provisional diagnosis ischemic heart disease, likely stable angina, is spot on, considering typical exertional chest pain, pressure like radiating to the left arm or jaw, relieved by rest, presence of multiple risk factors, age more than 55, which is one of the non-modifiable risk factors, the smoking, hypertension, hyperlipidemia, and male gender. That's why we have always to consider the gender of this patient. Male patients are more predisposed to ischemic events like strokes, ischemic heart disease, cardiac problems, neurological problems, TIAs, and a lot of other problems. Here are the next step we have to make to confirm the diagnosis. Apparently, we have to do an ECG, and we might just see a normal ECG because it's an ischemic problem. The symptoms come and go on exertion. So maybe during the episode we would find the ischemic changes in ECG, like ST depression and T wave inversion, but otherwise we might find a normal ECG. Cardiac enzymes will be normal. We have to make it to rule out acute events like MI. Exercise stress test. That's the gold standard to diagnose ischemic heart disease stable angina is exercise stress test, that the patient will become dyspneic and having chest pain and become decompromised during the exercise stress test, which is the most important in diagnosis of this case. Echo is okay to have to assess the abnormalities in the structure of the heart, coronary angiography, if high suspicion or abnormal stress test. All right. So the treatment, first of all, in any disease, we have to consider firstly the non-pharmacological treatment. We have to look for the diet and the exercise. But as long as this patient is ischemic heart, we have to put this patient on mild to moderate exercise, not severe exercise, because exercise is an exertion and he gets an exertional pain elicited by exertion. So we have to avoid high intensity exercises to avoid this problem. So it's also important to consider that he's alcoholic. So we have to ask about the liver problems. Apparently he has removed the gallbladder. It's important to ask if has any GERD or peptic ulcer disease, dyspepsia, antiplatelet. It's important. Aspirin, statins, beta blockers, and sublingual nitrates during the attacks. Here we go. We've reached the diagnosis. If you like this series and you have to see another episodes, drop down a comment. I talked so long, but it's important to know some details, especially that if the patient is not an emergency patient, not coming to ER, and the patient is apparently and currently controlled, because this pain just comes in attacks. But when I was like, I'm imagining that I'm in the clinic or in the hospital and the patient is approaching to me, he seems to be fine, he's just having the pain during exertion. So this is the end of our video. See you in next episodes. Bye.